So Jason asks, Professor Wolters, how did COVID impact your mental health as an educator? And I'll be honestly, as an educator, my most mental health worries were really about my students, because I know how important social interaction is, social life is for college students, and the fact that they were kind of ripped apart and separated and didn't have their friends, didn't have their fraternities, their sororities, their student organizations in the way they used to, that it really hurt them. I mean, I had more students, I've been teaching for 20 years, and I'll be honest with you, last semester I had more students that wrote me about suicide, that wrote me about mental health issues than I've had in 20 years. Literally in about a 2-month span, more than in 20 years of teaching. And so what we try to do is actually help the students more by helping have more outreach. You'll see there's more organizations out there. I tell my students, look, join a student organization, find a group, find a fraternity, a sorority, something, whatever you like to do, join that group, because we need that social interaction, because the lack of that really impacted people's mental health, but also just their souls in general. And that's why it's really important for students to get back to kind of the way things were with the interaction, with being in the classroom, to help them really feel like they're a part of something again. Because honestly, my worst mental health part was just worrying about my students. So that's why I had extra office hours online. You want to Zoom, we can talk. We do YouTube live feeds. I mean, we ended up doing a 15-hour or 16-hour, one of the 50 to 16-hour live class where I did a whole class straight through to raise money for our emergency dean program at the University of Illinois, so they could help out students that are in need. And honestly, if you want to help out students, I actually have a link to that emergency fund down below to help out students, so please donate if you can to help them out. But that was one thing I saw, is students were just really hurt and lost, and that hurt me personally. That hurt me as an educator, because I want my students to succeed. I want my students to be happy. I don't want them to be in a bad space mentally, and so that affected my mental health, is worrying about my students. I was lucky enough that my wife and kids were there. We did not lose anybody directly in our family to COVID, so we kind of got lucky that way. But I know not everyone was that lucky, so I think we were blessed through that. And mental health wise, we were pretty helpful. Though I will say, physically health wise, I had lost about 50 pounds before COVID, and I put about 2/3 of that back on during COVID. So maybe my mental health became my mental eating. I don't know, but it was a tough time for a lot of people during that. But mental health wise, that's kind of where it was for me and where I saw my students. So Jason, I hope that answers your question, or at least gives you a rough idea of how it was for me and for my students. So thanks for the question. If you have questions for Professor Wolters or questions for professors in general, put in the comments section below so we can answer more questions to help you understand life of being a professor. Because sometimes, yes, you still have to work when they're hammered away behind your head.